And I now give the floor to Sri Lanka.
Ustedes la palabra.
Thank you, Madam Chairman, for giving me the floor. Madam Chair, today, as we celebrate the 30th anniversary of the historic International Conference on Population and Development, it is incumbent, we say, upon all of us to revisit the progress made in its implementation and to identify the areas that need to be improved in the coming years in the context of contemporary global challenges. Madam Chair, rapid population growth is at the center of many of the world's pressing environmental, economic, and security issues. Without a significant slowing of population growth, we face irreversible degradation of the natural environment and continued poverty for much of the world. We must remember, Madam Chair, that the world is finite. We are in a world where the population is more than 3 times larger than it was in the mid-20th century. The global human population reached 8.1 billion in 2024 from an estimated 2.5 billion in 1950, adding 1 billion people since 2010 and 2 billion since 1998. Now, this number is expected to increase by nearly 2 billion persons in the next 30 years, from the current 8 billion to 9.7 billion in 2050, and could peak at nearly 10.4 billion in the mid-2080s. An alarming prospect, isn't it? Madam Chair, in the above context, it is very important that we take note of the rapid population growth trends, as it necessitates the expansion of the scale of investment needed to satisfy the basic needs and assure protection for all. Countries with growing populations have potential for and assure protection for all, and countries with growing populations have the potential for demographic dividend once the fertility rate declines. However, this will only become a reality only if people have quality education, good health, and decent work. When the CPD57 was held in Nairobi in 2019, the world was able to witness the positive side of initial inception of ICPD in 1994, such as the 25% prevalence rate of global contraceptive prevalence. While we should commend all the stakeholders involved for the achievements made, we are of the view that we must not be complacent and let the progress slow down at this point. Madam Chair, even though ICPD was primarily intended to provide systematic and comprehensive integrated approaches to population issues, the developing countries are still facing a number of difficulties stemming from the unfavorable economic environment. At the time, as I speak, more than 2 billion people still live in poverty and remain left out of this progress. The great challenge leaders of the world face today is to reduce poverty and inequity and improve people's lives without compromising the environment and the well-being of future generations. Madam Chair, notwithstanding these challenges, my country, Sri Lanka, has made significant strides in advancing its health and development objectives in the last year. The investment made by successive governments in Sri Lanka on education and healthcare have resulted in impressive social development indicators that the country has managed to sustain even in the midst of financial and economic constraints. There have also been a number of welfare measures undertaken. For example, in coordination with the UNFPA, Sri Lanka has introduced a national bereavement care package in 2023. Under this scheme, evidence-based care pathways are furnished to the professionals engaged in providing bereavement care to patients and families. In addition to the above, in partnership with the Sri Lanka Medical Association, Perinatal Care Society of Sri Lanka, and the Menopause Society of Sri Lanka, the UNFPA took steps to facilitate advocacy dialogue highlighting the significance of integrating sexual and reproductive health and justice into the healthcare system. These dialogues were based on critical topics such as challenges in midlife fertility, women's ability to make choices, and addressing gaps in disability during pregnancies. So, recognizing the pivotal role of women and girls in achieving inclusive and sustainable development, the government of Sri Lanka has in place a national policy on gender equality and women's empowerment. Our free education system has contributed in a substantial manner to achieving gender parity in education enrollment and high female completion rates. Despite this, women's participation in formal employment remains low. To address this, Sri Lanka is in the process of enacting relevant legislation to remove the barriers that are prevalent today. We are also implementing a national action plan to enhance prevention and response to gender-based violence. Over the years, our free universal health policy has enabled us to achieve commendable progress in sexual and reproductive health. The unmet need for family planning is 7.5%, and maternal mortality is at 29.5 per 100,000 live births, amongst the lowest in South Asia. We are continuing to invest in improving sexual and reproductive health services and enabling young persons to gain better access to information, particularly on gender, sexuality, contraception, and sexually transmitted infections such as HIV. Madam Chair, we are cognizant that despite the progress made in the ICPD, several gaps remain in the implementation. In this regard, voluntary commitments are made by the member states to further the 2030 agenda of high importance to Sri Lanka. In conclusion, Madam Chair, Sri Lanka reiterates its commitment to the ICPD. It is our strong belief that reviewing the progress made by the ICPD at this milestone would provide us with the catalyst to determine the roadmap of the ICPD and focus on our priorities in a pragmatic and meaningful manner. Madam Chair, may I conclude and permit me to leave you with the thought that population growth is not just a problem of members. It is also a problem of sustainability. We must find ways to ensure that our growing population has access to resources, education, and opportunities, while also preserving the environment and protecting the rights of future generations. I thank you, Madam Chair.
Agradezco al distinguido embajador.
I thank the ambassador from Sri Lanka, and I give the floor